Our peer educators received 44 hours of education on topics such as diabetes, hypertension, and techniques on teaching classes and motivating clients.
Merced County's self-monitoring blood pressure strategies include providing blood pressure kits to all county library branches for checkout. In 2014, the Merced County Department of Public Health trained 16 lifestyle coaches from various organizations. In 2017, Lifetime staff was successful at working with Merced County to begin a worksite wellness program for all county employees called Wellness for You.
So we start with some data around diabetes, and then we move on to prevention. And so for the diabetes section, we have information about the YMCA's Diabetes Prevention Program and a downloadable referral form for providers, as well as resources for referring to diabetes prevention programs and screening patients. And then we have information about Prevent Diabetes Stat. For community members or patients, we wanted to make sure that if a community member came across this website, that there was going to be information that was directed towards them. And so we start with some information, some general definitions around diabetes, and then we give specific links for what can you do if you have prediabetes and what can you do if you have type 2 diabetes.
About every 40 seconds, someone in America has a heart attack or stroke. Stroke ranks number 5 amongst death, and stroke is a leading cause of serious long-term disability.
We have about 65,000 patients, 275,000 visits. 99% of our patients are below 200% of the federal poverty level. That is our greatest disparity right there. And even on top of that, we still have 9 to 15% of our patients that have no insurance.
In San Joaquin County, we've had the excellent opportunity to do great work on all 15 strategies of the Lifetime of Wellness program over the past few years. The following are a few highlights of that work. We have created signage in both English and Spanish to alert community members as to where they can find fresh fruits and vegetables, but we have also implemented quite a few changes to store environments. In an effort to help create a healthier workforce in San Joaquin County, we have developed walking path signage for employees to utilize on their breaks or at lunch. These map boards, along with accompanying map cards, allow employees to know how far they've walked and approximate calories burned. This is a brief snapshot of what we've been able to accomplish with the Lifetime of Wellness program grant over the past few years. We hope you enjoyed it.
Today is National Diabetes Association Alert Day, and Shasta County is alerting its residents to an alarmingly high amount of residents that are considered pre-diabetic.
If you look at diabetes, it's 50% of our Shasta County residents are pre-diabetic, and then you also look at physical activity, less than 50% of people are being physically active for 30 minutes.
Across the nation, it's no secret that diabetes has become a huge issue.
Hi, I'm Kirby Brooks, Health Education Specialist with Solano County Public Health, your Health Promotion Community Wellness Bureau, also known as Vibe Solano.
Vibe Solano, brought to you by Solano Public Health, is here to work with our community partners to make Solano a vibrant and healthy place to live, learn, work, and play. One of our projects is Healthy Stores for a Healthy Community. We are asking store owners to switch to healthy checkouts so that we can end our shopping on a healthier note.
99.7 Classic Rock wants to help beat chronic disease in Tulare County, where 1 out of 2 adults is pre-diabetic or diabetic. Possibly me, you, or half of everyone listening. So check your risk at testyourBloodSugar.org. Answer 7 simple questions with a yes or no, and see right away if your risk for pre-diabetes is low, medium, or high. If your risk is high, consider getting a blood sugar test right away. This is April Sky with a message made possible with funding from the Centers for Disease Control and Prevention.
Today, Teresa and her sister want to bring Miguel to the health fair, but he doesn't show up. Not believe it, but there are people that can help all around you.
My name is Chris Burke. I'm 62. I'm a teacher in Soledad, California. I knew I had a problem. I knew I was a candidate possibly for diabetes. I used to sit around in front of the TV and eat chips chased down by soda and getting no exercise, and that was sort of like committing suicide slowly. It's so easy to do bad. And that's why I think this program makes a difference. It stops me from doing the same things I've been doing all the time.
The well-integrated screening and evaluation for women across the nation, also known as Wise Women program, is a CDC-funded program that contracts with select federally qualified health centers to provide low-income, underinsured women that are 40 to 64 years old who are enrolled in the National Breast and Cervical Cancer Early Detection Program and who are at risk for cardiovascular disease with the knowledge, skills, and opportunities to improve their health status to prevent, delay, or control cardiovascular disease.